end of the day, you pull off your socks, and there they are. Deep grooves pressed right into the skin.
You press your thumb into the swollen skin above the ankle bone. The dent holds. 5 seconds, 10. The tissue just sits there, cratered.
It happens so gradually that most people barely notice. Shoes kicked off, feet swollen, ankles heavy. It's not pain exactly. It's more like a deep, tired weight that settles in by evening. And for millions of people, this is just how every night ends. Look at the difference. In the morning, the ankle is slim, defined, normal. By evening, it's visibly thicker, puffy, the skin stretched tight. Same ankle, same day, but something has changed inside, and that change is worth understanding. Let's go inside. Right now, deep within the tissue of your lower leg, there's a network of blood vessels so thin their walls are only 1 cell thick. These are capillaries, and through them, fluid is constantly moving, seeping outward, delivering oxygen and nutrients to every cell that needs them. At the arterial end of a capillary, the side closest to the heart's pumping pressure, fluid is gently pushed outward through tiny gaps in the vessel wall. This is completely normal. It's how the body feeds its tissues. The fluid carries what the cells need, moving from inside the vessel into the space between cells, a zone called the interstitial space. But here's where the balance comes in. At the venous end of that same capillary, where the pressure is lower, most of that fluid gets pulled back in. The force doing the pulling is called oncotic pressure, created by proteins in the blood, especially one called albumin. Think of albumin as a molecular sponge, drawing water back into the bloodstream. Whatever the capillaries don't reclaim is picked up by a second system, the lymphatic system. Tiny, green-tinted vessels weave quietly between cells, collecting leftover fluid, filtering it through lymph nodes, and returning it to the bloodstream near the neck. It's the body's hidden cleanup crew. Now here's the part most people miss. When you're standing or sitting upright, gravity pulls everything downward, including the column of blood and fluid inside your veins. The pressure at the bottom of that column, down in the feet and ankles, is significantly higher than the pressure up near the chest. The legs don't get swollen by accident. They're targeted by physics. And this is where things start to tip. Down at ankle level, the capillaries are already under more hydrostatic pressure than almost anywhere else in the body. More pressure pushing outward means more fluid leaving the vessels. If the return systems, the veins and the lymphatics, aren't working efficiently, that extra fluid has no easy way back up. It just accumulates. On the surface, the skin around the ankle becomes taut, slightly shiny, warm to the touch. The tissue underneath is waterlogged, saturated with fluid that should have been reclaimed hours ago. And when you press a finger into that swollen area, the dent stays. This is pitting edema. The depth and duration of that pit actually tell doctors something important. A shallow dent that refills quickly suggests mild fluid buildup. A deep pit that lingers for 15, 20, 30 seconds tells a different story. The longer it holds, the more fluid has accumulated. Mornings are usually better. After lying flat through the night, gravity redistributes the fluid more evenly. The ankles look slim again, the shoes fit. For a few hours, everything feels normal. But as the day goes on, especially if the person has been standing or sitting without much movement, the fluid migrates downward again. By evening, the heaviness returns. The shoes tighten. The ankles lose their definition. And the marks come back, pressed deeper than the night before. This cycle can persist for weeks, months, even years. And while many people learn to live with it, the question always lingers. what exactly went wrong inside? The answer is rarely just one thing, and the triggers are often hiding in plain sight. The single most common trigger is something most people do every single day without thinking about it. Prolonged stillness in an upright position, standing behind a counter for hours, sitting at a desk with legs hanging down. The body is upright, gravity is pulling, but the legs aren't moving. And that matters more than most people realize. Here's the key mechanism. The veins in your legs don't move blood upward by themselves. They rely on the calf muscles to squeeze them. Every time the calf contracts during walking, it compresses the deep veins and pushes blood upward, past a series of one-way valves that prevent it from sliding back down. When you sit or stand without moving, that pump is essentially switched off. Blood pools, pressure builds, fluid leaks out. Now picture the opposite. The same leg during walking. The calf muscle contracts, the vein compresses, and blood surges upward past those one-way valves. This is the calf muscle pump in action, and it's one of the most important mechanisms keeping fluid out of your ankles. Long-haul flights are a concentrated version of this problem. Hours of sitting in a cramped seat, knees bent, feet flat on the floor, the calf pump barely activates. The veins in the lower legs are fighting gravity with almost no mechanical help. By the time the person stands up at arrival, the ankles may already be visibly swollen. Shoes that fit comfortably at departure now feel a full size too small. And most people assume it's just the flight, but really it's physics plus stillness. Warm environments add another layer. When the body gets hot, blood vessels near the skin dilate to release heat, a normal cooling response. But wider capillaries in the lower legs mean more surface area for fluid to leak outward. The swelling isn't caused by the heat itself, it's caused by the body's own cooling strategy, temporarily increasing blood volume in the periphery. Dietary salt plays a quieter but powerful role. Sodium causes the kidneys to retain more water, which increases overall blood volume. More blood volume means more pressure inside the capillaries, and more fluid pushing outward into the tissues. The body doesn't always signal the excess with obvious thirst. Sometimes it signals it with swollen ankles the next morning. This one surprises many people. A number of widely prescribed medications can cause or worsen leg swelling as a side effect. Certain blood pressure medications, especially calcium channel blockers, are well known for it. The swelling may appear gradually, weeks or months into treatment, and patients sometimes never connect it to the prescription. The mechanism is a pressure mismatch. These medications dilate the small arteries without a matching effect on the veins. That widens the pressure difference across the capillary bed and drives more fluid outward into the tissue. Other medication classes that can contribute include corticosteroids, non-steroidal anti-inflammatory drugs used regularly, certain diabetes medications, and hormone therapies. As the body ages, several of the systems that manage fluid become less efficient. Venous valves weaken and start to leak. The lymphatic system gradually loses drainage capacity. Kidney function may decline slightly. Skin loses elasticity, offering less resistance to tissue expansion. None of these changes cause dramatic swelling overnight, but they create a background vulnerability that builds over decades. For many people, leg swelling starts as an occasional inconvenience, noticeable after a long day, gone by morning. But over time, the pattern can shift. The swelling starts lasting longer. Where it once resolved fully overnight, traces linger into the next morning. The skin may begin to change, becoming drier, slightly discolored. This progression happens because chronic fluid accumulation doesn't just sit harmlessly in the tissue. Over time, the excess fluid triggers low-grade inflammation. The inflammatory response stimulates fibrosis, the laying down of extra connective tissue fibers, which gradually stiffens the tissue and makes the swelling harder to reverse. What started as soft, pitting edema can evolve into something firmer and more resistant. Shoes become a daily negotiation. People start buying footwear a half size or full size larger. Some avoid lace-ups entirely because the swelling makes them impossible to fasten by afternoon. It's a small adjustment, but it reshapes the routine in ways that go beyond comfort. Sleep can be disrupted too. Lying flat at night redistributes the pooled fluid from the legs back toward the central circulation. The kidneys process it, and the person wakes to urinate, sometimes multiple times. Doctors call this nocturia. The body that spent all day accumulating fluid in the legs now drains it through the kidneys when gravity is no longer holding it down. And underneath all of this, there is often a psychological weight. People notice their swollen ankles and wonder if something serious is wrong. They search online, find a confusing range of possible causes, and feel more anxious than before. That anxiety is worth acknowledging. It makes sense to want to understand what's happening inside your own body. When the venous valves in the legs weaken or fail, a condition called chronic venous insufficiency, blood begins to fall backward between heartbeats. It pools in the lower veins, raising the pressure inside them. That elevated pressure pushes directly into the capillary beds, forcing more fluid out into the surrounding tissue. Over time, this stagnant blood and elevated pressure leave visible marks on the skin. The area around the ankles may darken to a brownish discoloration. This is hemosiderin staining, a sign that red blood cells have leaked out of the capillaries and broken down in the tissue, depositing iron pigment. The skin may become dry, itchy, or develop a leathery texture. Varicose veins are a related phenomenon. These are superficial veins that have dilated and become visibly twisted because their valves no longer close properly. They don't always cause edema on their own, but they're a visible marker that the venous valve system is under strain. If the venous system is the main highway for fluid return, the lymphatic system is the secondary road. Slower, lower volume, but essential for handling the overflow. When the lymphatic system is damaged or overwhelmed, that overflow has nowhere to go. The fluid accumulates, producing a type of swelling called lymphedema, which tends to feel firmer and denser than venous edema. One distinguishing feature that doctors look for: lymphedema often affects the top of the foot and toes in a way that venous edema does not. There's a clinical test called the Stemmer sign, an inability to pinch a fold of skin on the top of the second toe. It's a small clue, but a meaningful one. Now let's look at the heart. The heart is the central pump of the entire circulatory system. When it weakens, particularly the right side, the effects ripple backward through the venous system. Blood backs up, venous pressure rises throughout the body, and the legs, being the lowest point, bear the brunt. This is venous congestion, driven by heart failure. Edema caused by heart failure tends to be bilateral, both legs equally, and it often worsens over the course of the day. But when leg swelling appears alongside breathlessness, fatigue, or a persistent cough, it raises important questions about cardiac function. This doesn't mean everyone with swollen ankles has heart problems, but it means the pattern matters. The kidneys play their own role. When kidney function declines, the body holds on to excess sodium and water, increasing blood volume and raising capillary pressure, especially in gravity-dependent areas like the legs. The kidneys are the body's fluid regulators, and when they fall behind, the evidence pools at the ankles. Here's a pattern that helps doctors narrow things down. Kidney-related edema often appears not just in the legs, but also around the eyes and face, particularly in the morning. Facial puffiness in the morning, leg swelling later in the day. The fluid migrates with gravity throughout the day, and that daily migration is itself a diagnostic clue.
The liver plays a different but related role. A healthy liver produces albumin, the protein that creates oncotic pressure, the force that draws fluid back into the capillaries. When the liver is damaged, albumin production drops. With less albumin in the blood, less fluid gets pulled back in, and more stays in the tissue. That's why liver disease can cause edema in the legs and significant fluid accumulation in the abdomen.
Not all leg swelling is systemic. Sometimes the swelling is local. A deep vein thrombosis, a blood clot in one of the deep veins of the leg, can cause sudden swelling in one leg, often with warmth, redness, and pain. When swelling appears suddenly in just one leg, especially with these signs, it warrants prompt medical attention. Let's clear up a common misconception. Many people assume that drinking more water makes swelling worse. It sounds logical, more water in the tissues, but the body doesn't work that way. Adequate hydration actually supports healthy kidney function and fluid balance. It's excess sodium, not excess water, that tends to drive fluid retention. When a patient presents with leg swelling, the diagnostic process starts not with tests, but with observation. A doctor presses into the swollen area, checking whether the edema pits and how deep the indentation goes. The skin is inspected for color changes, thickening, warmth, and tenderness. Pitting edema is itself a diagnostic test, a window into what's happening beneath the surface. From there, targeted investigation follows. Blood tests may check kidney function, liver function, albumin levels, thyroid hormones, and a protein called BNP that reveals whether the heart is under strain. An ultrasound of the leg veins, called a venous duplex scan, can check for blood clots or valve dysfunction. An echocardiogram can assess how well the heart is pumping. The point of all this is not to overwhelm. It's to show that leg swelling, as simple as it looks from the outside, can open a window into the function of multiple organ systems. And that's exactly why doctors take it seriously. Not because swelling is always dangerous, but because it can be a surface signal of something worth understanding more deeply. So, what does management generally look like? It always starts with the same principle: find the source. If the swelling is driven by a medication, the doctor may adjust the dose or switch to an alternative. If the veins are the problem, treatment focuses on supporting venous return. If an organ is involved, managing that organ directly is what ultimately controls the fluid. Treating the swelling alone, without addressing the cause, is like mopping a floor while the tap is still running. The fluid will keep coming back unless the source of the imbalance is identified and addressed. That's the principle that guides every approach. For many people with chronic venous insufficiency or lymphedema, graduated compression stockings are one of the most commonly recommended tools. These garments apply the most pressure at the ankle and gradually less pressure moving up the leg. The external support helps counteract gravity, squeezes the weakened veins, and promotes fluid movement back toward the heart. Inside the leg, the effect is mechanical. The compression physically narrows the veins, increasing the velocity of blood flow upward. Fluid that was pooling in the tissue gets redirected. Physics working in reverse. Elevating the legs above heart level is one of the simplest and most effective strategies. Even 15 to 20 minutes several times a day can make a noticeable difference. Gravity, which spent all day pushing fluid downward, now helps it drain back toward the central circulation. Movement works through a different mechanism. Walking, calf raises, even ankle circles while seated. Any activity that contracts the calf muscles activates the calf muscle pump. The deep veins squeeze, the one-way valves open, and blood surges upward. For people who work in sedentary positions, periodic movement breaks are one of the most practical interventions available. When the body is retaining too much fluid due to heart failure, kidney disease, or certain other conditions, doctors may prescribe diuretics, commonly called water pills. These medications signal the kidneys to excrete more sodium and water,
which reduces blood volume and relieves the pressure that drives fluid into the tissues. But they require careful monitoring because removing too much fluid too quickly can cause its own problems. Because sodium directly influences how much water the kidneys retain, reducing dietary salt intake is a common general recommendation. It doesn't mean food has to be bland. It means being aware of where sodium hides, reading labels, and making small daily substitutions where possible. For many people, just reducing the most concentrated sources makes a measurable difference. This part often gets overlooked, but it matters. Chronically swollen skin is vulnerable. The stretched tissue has reduced blood flow, is prone to dryness and cracking, and heals more slowly when damaged. Keeping the skin clean, moisturized, and protected is a quiet but genuinely important part of living with chronic edema. Certain patterns should prompt a conversation with a doctor. New swelling that appears suddenly, especially in one leg, warrants prompt evaluation. Progressive swelling that gets worse week over week, or that no longer resolves overnight, suggests that the underlying cause is ongoing. And swelling accompanied by shortness of breath, chest discomfort, or rapid weight gain deserves medical attention.
The general principle is simple. If the swelling is new, progressive, asymmetric, or accompanied by other symptoms, it's worth having it evaluated. Not because swollen ankles are always serious, they often aren't, but because the symptom can be a window into something that benefits from early attention. What makes leg swelling medically fascinating is the sheer number of different conditions that can produce the same surface symptom. A cardiologist, a nephrologist, a vascular surgeon, and a dermatologist might all see the same swollen ankle and arrive at completely different diagnoses, each one correct for their patient. One symptom, multiple origins. Those deep sock marks at the end of the day are not just a trivial annoyance. They're a readable signal, a message from the body about pressure, gravity, fluid, and the systems that work to keep everything in balance. Understanding what produces them doesn't just satisfy curiosity. It builds the kind of body awareness that helps a person know when something is routine and when it might be worth a closer look. The body is remarkably transparent when you know how to read its signals. Swelling is one of the clearest it offers, a signal printed right there on the skin, in the pattern of a sock. If you've ever noticed those marks on your own ankles, or if someone close to you has dealt with swelling that just won't go away, let us know in the comments. And if there's a body topic, a symptom, or a condition you'd like beyond the symptoms to break down in a future video, drop it there too. If this helped you understand something new about what's really happening inside, give it a like and subscribe so you don't miss what's next.